Wednesday morning, folks. Hope everyone's doing well. We've got some very, very, very tardy people this morning. I think they maybe woke up in the middle of the night, looked outside, saw how dreary it was, and maybe said, let's just bump that alarm clock a little bit further along. But no, not your chamber guy. Your chamber guy's here at 7 o'clock in the morning, getting things ready and preparing for the day. This morning we're gonna have a lot of interesting discussion about politicians' decision making, and we have my friend and everybody here's friend, the former MPP for Cambridge, Dr. Rob Leone, who is actually, he holds a PhD in public policy, and he serves as an associate professor of leadership and policy at Niagara University in Lewiston, New York, believe it or not. And in addition, he's a principal as well at Earnscliffe Strategy Group in Toronto, where Earnscliffe really deals virtually almost exclusively with government and in helping them or trying to help them and guide them and give them feedback and input, and works with organizations. Actually, we're a very strong advocate for us in the all-way 2-day go proposal, and did a tremendous amount of work. Yeah, there it is right there. Did a lot of work to help make that come to fruition. And so Earnscliffe Strategy Group is working very, very hard, as is Rob Leone. So Rob, welcome this morning. How are you?
I'm well. How are you, sir?
I'm good. I'm good. So maybe one quick question. How are you an associate professor at a university in Niagara Falls, New York?
Well, they hired me. That would probably be number one answer.
How do you do your job? Is it all virtual?
Yeah, it's all virtual. I'm broadcasting live from Ayr, Ontario today, where I've been doing most of my teaching. Most of my teaching actually is on weekends because I teach in a PhD program, and my courses run on Saturdays. So I often, when I go there, I usually go on up Friday night, but now I have to say I can't. I'm teaching right where I'm sitting. So just like the rest of us.
Yeah, well, yeah, we're all kind of, I think, there was an interesting comment on the radio this morning. There's people are now saying, as we see the light getting brighter at the end of the tunnel and vaccines taking hold, and other jurisdictions saying, BC, I think, is saying by the fall, masks are going to be optional. Now people are coming out of the woodwork and saying, well, I'm not quite sure I'm going to be good with that. I'm still going to have some reservation. And you kind of wonder, maybe they've just gotten so used to working from the comfort of their home office that maybe it's going to be a pain in the neck to get dressed and get up and go out into your car and go to work somewhere. But there's still a little bit of it. I want to talk about Rob with you. You wrote, I think, probably one of the most interesting papers from my perspective, because I'm always trying to figure out why government makes the decision they make. I just about question every single decision that they make, whether it's good for me or whether it's bad for me. I always want to kind of understand that. But Rob wrote an op-ed in the Hub. Actually, it was his first article, thehub.ca, if you're interested in going to read the full article. And it was entitled, "Our Leaders Are Groping Along on COVID-19, and There May Not Be a Better Way." It was kind of interesting, and knowing Rob always looked for the better way. But today, when you read his article, it will give you some real thoughts to ponder on how in the world government could possibly navigate and come out with the right solution. So in essence, I think, Rob, what you are more or less saying is there is no right way. There are just multiple ways. And it's almost a roll of the dice from a political leadership perspective to say, well, let's try this. while science plays a role and obviously public pressure play a role, really, it's almost impossible for anybody to get this right. And if they do get it right, it's purely by guessing lucky.
Yeah, like I mean, let's start from first principles. When you're in government and you're trying you have a problem that's confronted your government, your society, the people that you're governing. The first thing is let's define the problem. All right. So we have a public health crisis. We define it in a multitude of ways. There are people in the camp of COVID zero, minimize infection to as close to zero as you can. There are people in that camp. There are people in the camp that we should minimize, COVID infection and death so that our hospitals aren't overwhelmed. So there are people in that camp. And you've got people in the opposite camp, which is, COVID is a illness. It's like the flu. Every time we get the flu, it's not like we shut things down, but we have to wear masks and so on and so forth. And so you have a whole spectrum of a whole range of problem definitions that are out there. So problem number one for government is that no one's on the same page on what the problem is, or what the goal of policy should be, right? So government has to settle on, okay, well, let's minimize, let's make sure that we're not overwhelming our hospital system, which is what most governments in North America are trying to do. And so all of their decisions are geared toward, let's try and strike a balance between keeping the economy open and keeping people's freedoms in place while trying to protect the vulnerable, while trying to protect, minimize infection so that our hospitals don't get overwhelmed. So you've got that bucket, that mess that governments have to wade through. So they do decide, they ultimately do have a what we would call a policy anchor or a goal. And governments don't know exactly how to get to that goal. That's the next piece, because no one has done this before. No one has signed up, and I know we have a few of our municipal leaders on here. No one has signed up to deal with a public health crisis. No one has signed up as a government official and as a leader to try and determine how much infection and how much death is acceptable in society. Like, that's not a decision people sign up for, right? But obviously people sign up to be in politics to help people. And so you want to do what's best and what is right. So you have that obviously as another bucket of issues in terms of trying to you're dealing with public officials who by and large aren't prepared to deal with the crisis that's before you. There is no roadmap on how to actually do this. And then it's about trying to get information to the right information and listening to the right information. I think public perception is that there's not enough information, or people aren't listening to the right people, that information is not flowing in the right direction. But the actuality is the opposite. Right? There's actually too much information. People will say, well, let's listen to the science table. Do you know how many tables are advising the provincial government on COVID? There's at least a dozen, probably more. Right? So you can listen to the science table, but the science table might not be saying the same thing as the economic reopening table, may not be saying the same thing as the public health table, may not be saying the same thing as public service table. And when they're saying different things, governments have to decide. Right? So the other problem is that we live in an environment we want instant decisions, because we can go on Twitter and talk about it, and say, well, why aren't you doing this? And as soon as that happens, as soon as an expert, I'm an expert in government decision making, and half of you probably think I'm full of crap. I will admit that probably by the end of that, at the end of today, some of you may think that. But I can go on Twitter and I can write an article on the Hub, and I can proclaim my expertise in government decision making, and I've got my soapbox, right? Everyone else who disagrees with the government or what the government is doing also has that soapbox. And the number of medical doctors, epidemiologists, virologists that have become famous as a result of this pandemic has grown exponentially, right? And they all have their following. They're all saying things. They're all casting doubt on government decisions. So it's an impossible position for governments to ultimately be in. So they make a decision, they go through that, they think it's well informed, they test it, they realize, well, people don't like not going to playgrounds. Let's open the playgrounds. The golf people won last weekend. Greg and I look like we're ready to go golfing today. And this cycle continues and continues. And so the point is not that there isn't the right way, it's just we don't know what the right way is. We have a goal in mind, which is to see us to the end. We just don't know how to get there.
Will we ever, when this pandemic's done, and I think back to the SARS, and I read through the SARS Commission, mostly the executive summary because it's a little easier to read than the body of the document. But there were a lot of interesting things. One of the things was, the precautionary principle should lead the way, and we shouldn't be always waiting on everything for scientific certainty to make some decisions. So, that kind of relates to the mask wearing thing, to the rapid antigen screening program, all of those kinds of initiatives, the washing your hands, the physical distancing. Those are all precautionary measures that we put in place that we say, gee, it sounds like it'd be a good idea and it would probably help. So let's just do them. Do you think once this is all done and the commission set up to review government's moves, actions, decisions throughout this process, if there were another global pandemic like this, would it be different? Would we see different decisions? Would there be more of a public acceptance of those decisions because we now have this reference manual to say, here's where we made the mistakes, here's where we did things right? Do you think that will happen?
I think that's a good question. You mentioned the SARS. It's not like we haven't gone through this before, or there hasn't been a playbook. But the reality is, an honest look at where we are with this pandemic. We were completely unprepared for it. Early decisions on long-term care caused catastrophic death in our long-term care facilities. Our inability to mix vaccines domestically. These are all decisions that past governments have made that completely made us unprepared to deal with the problem that's before us. And the other problem that's before us, which we don't tend to talk about a lot, is our health human resources, the people that we rely on in a public health crisis to help us through from a health perspective. We haven't trained enough. And that's not something that we can do overnight. It takes, I'm at Niagara University Associate Dean of a Teachers College. It takes 2 years to make a teacher. You can't just throw anyone into the classroom and expect them, them to make miracles. It's not an easy job. If you want to if you want to train nurses, it's a 4-year thing. PSWs, you're at least, a year in. You can accelerate that to 6 to 8 months, but by and large, you've got these problems. And so we have a shortage of people to actually deal with the crisis that's before us, which is also the next part of the problem, right? So, are we going to deal with the health human resources element of this post-pandemic? Remains to be seen. And there's enthusiasm now, but the government realizes that in order to have 10,000 or 20,000 new PSWs in our long-term care homes, that's going to be a 4-year endeavor. It's not going to be something that we can basically snap the fingers and achieve overnight. So I think the intention post-pandemic will be, let's make sure that we're not caught with our pants down again going forward. But as the time between end of pandemic and say 5 years, 10 years out, the more time that the bigger that gap in time, the less enthusiasm there will be to create policies that are going to prepare us for the next pandemic that's going to happen. So, and there's real pressures for that. There's fiscal pressures that we haven't even begun to talk about yet. There are things that we want to do from an economic perspective, an economic development perspective, to try and focus on a recovery that helps all people. Focusing on obviously the people that have been devastated by this, the people who work for small businesses and small business owners the folks that are members of the chamber, like we've got to find a way to help these people. So I think there's going to be an enthusiasm early on to, right now there is no real spending cap or pressure to reduce spending because we're dealing with a pandemic. But 3 years out, does the same circumstance exist? Probably not. And so then governments are going to be making decisions that say, look, I know we said we were going to have, create vaccine capacity or domestic supply of PPE or, an early pandemic concern in Canada nationwide was if the United States closed their borders, will we have enough domestic food to sustain ourselves for a duration of time? So we were talking about things like how do we convert greenhouses that are seeding flowers into actually producing produce? Like these are like real concerns that you think, whoa, man, this could actually have gone way more catastrophically had different decisions been made and cooler heads not prevailed. So it's a testament of people collaborating and working together, which I still think that spirit exists, although it's waning as again from March 2020 as we get on to the summer, it's waning significantly. I think people are just fed up with this entire thing. I count myself among them. So I think the enthusiasm for action will disappear. It's not going to be indefinite.
Yeah. We've always talked about, since the very beginning, we talked about, the new normal and what is the new normal going to be. And then you hear jurisdictions, well, actually saw something. I actually was watching the golf on the weekend, the Players Championship, and, they had, tens of thousands of people following the golfers around the course in South Carolina, and not a, barely a mask to be seen anywhere. We're even though we kind of thought in the very beginning, well, the new normal is going to be masks are going to be pretty, frequently worn. We're going to wear them all the time. We're not going to give those up again. But boy, oh boy, I'm not so certain. There's such a desperation to get back to December 2019 in how we lived our lives that, are we going to just shed those precautionary measures that we've kind of gotten used to over the last year for, to say, oh, we've got our freedom back. You think that's going to happen?
I mean, it's such a variable question depending on how you've synthesized and have accepted news over the last 12, 18 months. People are going to have a certain comfort level of just going outside and walking in a crowd without a mask. People are doing that now. I think people are going to be on the opposite side, very reluctant, very anxious about the fact that disease still exists, and that any level of percentages that the vaccines won't cover, even if it's 90% effective, some people may think that 1 in 10% chance is a reason not to go out or not to go out unmasked. And so people are going to receive the information, and as they have throughout this pandemic, as they have throughout modern communications, they're going to take and listen to the experts that they have been following, that they trust. And that's going to mean some doctors who are overly cautious in the COVID zero frame that says, let's not open, let's not reopen, let's delay this until we get our infection rates to near zero so that we prevent a fourth wave. So now it's the pressure of not opening on June 2nd. We should delay it to June 16th. And then when June 16th comes, we should delay it to June 30th. So there's always going to be that group of people who are going to feel that any level of risk is an unacceptable and intolerable risk. And this has been with us throughout the pandemic, right? So early on in the pandemic, if we take ourselves back to a year ago, May 2020, there were things that we started to know about them. We didn't know about masks necessarily, or we had, some of us were going to the grocery store without masks. The barriers started going up. We didn't even know what we were doing. But remember what we did know, that catastrophic death was a predominantly senior issue, that this pandemic did not affect in an overt negative way that caused death amongst people that were sort of, let's say 18 to 30, and that the predominant center of the pandemic is centered around Toronto and Peel. So people outside Toronto and Peel felt like this was their problem, right? So I have neighbors that, have kids in their 20s, early 20s that, you wouldn't have known that they were worried about a pandemic, right? Because they didn't think even if they got sick, they wouldn't have died. I was worried about not giving COVID to my parents. So I was ultra safe, so people treat their situation differently based on their circumstance, and our circumstances aren't equal. We also know, and we've also learned through the summer, that the pandemic has disproportionately affected racialized communities and poor communities, right? So there are certain things that if you don't fit in that box, or if you do fit in that box, you're going to feel differently about the pandemic, based on that circumstance, and that's a challenge that we've all had to confront, because I think our the further out you get from the centerfold of infection, you have greater calls for let's loosen restrictions and let's do that. So the government last summer was like, well, let's do this regional color coding thing, and it's magically will be all better. Well, it didn't take people in York and Peel and Toronto too long to figure out that they can come down to Waterloo Region on Saturday or Sunday and go to the market, which happened. People region hopped because people don't want to be confined. It's so foreign to our being and our existence. We're a social species.
Mhm. You're an expert on public policy, and maybe even developing ideas or plans for. And I know you weren't. I know you didn't have all of the information that Doug Ford was getting on his desk or Justin Trudeau was getting on his desk. And I know based on your article, you are really talking about it's impossible to say, a government did this right or did that right or did anything right because it's just too much information for them to rationalize. They're trying to keep everybody happy, and they're in the end they're going to keep nobody happy. But from your personal perspective as a public policy expert, do you think that the federal and provincial governments did a good job throughout this pandemic?
The problem with that question, whenever you ask that question like that, so if I was in my public policy class talking to my students about this, problem number one would be like, what is our anchor? What's our assessment going to be based on? Because if it's based on our opinion, it's going to be variable with everyone that's on this call, right? So I think that's part of the challenge. The way I would evaluate public policy if I were teaching this to students would be to say, okay, what is your problem definition? Is your problem definition to get to COVID zero? No, the provincial government's was not to get to COVID zero. The provincial government's policy goal and objective was to not overwhelm hospitals. That meant that there was a minimum level of infection and death that was going to be deemed, although no one's going to say this out loud, deemed acceptable by the very nature of actually saying that you're going to have, you just don't want to overwhelm hospitals. You're saying that we're going to try and control spread, but we're going to let people live their lives to the greatest extent that we possibly can. And so you have these starts and restarts, starts and stops and restarts and restops and all these kinds of things, because that was their goal. Were they successful? I think that there are certainly mistakes that they were made. And I don't think any government that is trying to govern a diverse and what we would call pluralistic, where there's different opinions, would say that any government has done this flawlessly. I think people say, well, we should have done what Melbourne did. We hear these things. Well, New Zealand did it right. Well, there are certain conditions that were inherent there that aren't present here, first of all. Second of all, there are certain things that Melbourne did that would be completely unacceptable here. For example, in Melbourne, they went into their low-income, high-rise buildings, their affordable housing units, and policed the hallways so people wouldn't leave their apartments. That would not have been tolerated here. So, we can say, let's do what Melbourne did. And to be honest, I can tell you this group with a certainty, the Melbourne example was contemplated, and largely the gray lockdown framework reflected a lot of what Melbourne did. There's a couple things it didn't do. They didn't police low-income housing units. They didn't restrict people to 5-kilometer circumference around their homes, because you can't police that in rural communities. And they didn't prohibit interregional transit. So if I had an essential job in a different region, I could go to it. So but by and large, the rest of it, we did almost exactly the same as Melbourne. And almost as long in the case of Toronto. So, I think people have to take stock about that. The government's definitely made mistakes. All governments did this. This isn't a partisan thing. The current one of the current asks is to have sick pay for employees. There's governments of partisan stripes, different partisan stripes across the country, that are only now realizing that this should be an issue. Both the left and the right of the spectrum haven't done it, or slowly now doing it. So the issue of answering that question is hard, because mistakes were made, and there really wasn't a lot of buy-in at the end, and where we currently are, on what the appropriate acceptable level of risk and infection actually is.
So, maybe the problem to some degree is the fact that we live in a democracy. So if we didn't live in a democracy, it would be much easier to handle this, and the decision making would be easy, because it just comes right down from the top and it happens. Maybe a little bit of that. Well, I think it's fairly democratic, but Taiwan, for example, had an incredible record through this. But if you look back to their record in SARS, it was the world's worst record. So they were affected the worst of any other country in the world during SARS, and yet they performed the absolute best with respects to COVID. And it was, early reaction from their government that said, okay, everybody's got to wear masks. I guess, part of the benefit that Taiwan had is they actually make masks there. So it was pretty easy to say, okay, these factories are going to provide all of the citizens with masks. They did contact tracing. They were ahead of everybody in technology for contact tracing. And then they were an island. So it was kind of easy to stop anything from coming in. When you're an island, you stop flights. You stop people from coming in, because nobody's going to swim to you. So, I think there were a lot of cases that there were maybe a lot of actions that we could have emulated from countries like that. But then you have to look at the governance model that we have and say, well, people have certain rights that, we can't infringe on. So, this becomes a challenge for politicians that is beyond anything that they could have ever felt that they were going to be responsible for in getting into that line of work.
Yeah, I think you're right. We are a country governed by federalism, where some decisions are made in Ottawa, and some provincial decisions are made at provincial capitals. And also, let's face it, our local municipalities and our local public health units have a role to play in this as well, right? So there's a lot of decision points, which makes the whole thing very complicated. And the whole tussle over open borders or closed borders. I have colleagues that live in Ontario that were able to go and teach physically in at Niagara University on the Lewiston side since the pandemic started. I wouldn't have considered teaching that could be done virtually as an essential, but so it depends on who you get at the border sometimes, and how they're interpreting things as to whether you have to quarantine when you come back, which in many cases that I know never ever happened. We have international flights coming in. We have the whole domestic trade, which I referenced earlier. Like if the United States and Canada border was actually closed, like 100%, with no one coming in, no one coming out, domestic food supply would have been a problem. Our farmers rely upon temporary foreign workers. A lot of infection that came in May 2020 came as a result of temporary foreign workers in communities like, Huldom and Norfolk, Brant, having a lot of temporary foreign workers that were working in the fields that were getting COVID and massive spikes in infections that were had. So there's a lot of things that, that we would not be thinking about when we're making sort of very crass, statements like we should close our borders, because there are implications for doing all of those things, right? And so you have to weigh the positive versus the negative. You have to weigh whether you're going to tolerate a minimum level of risk versus, completely starving your people. I'm not trying to be dramatic here. I'm to say that they were concerned about putting food on the tables. It wasn't just toilet paper that was flying off the shelves last April and May. It was everything else. And so then we had to think about, okay, well, what are essential businesses? Well, food processors for sure, but food processors need plastics and cardboard to package the goods so that we can have our frozen dinners at night. Right. Well, you have to keep the plastic factories open. You have to keep the aluminum factories open. You've got to mine some of this material. It's not a simple cut and dry open versus closed. What's essential, what's not. And listen, I'm sympathetic to small businesses that say, why was Costco allowed to open and small businesses in our community that weren't allowed? I'm sympathetic to that. I don't understand it myself, but there was a rationale, not clearly articulated clearly, that went behind that as well. And part of it I think had to do with the fact that that our big box retailers could move product quicker and more efficiently, which minimizes mobility, travel, and so on and so forth. Whether I believe it, whether we buy it or not, is another thing. But there likely was a rationale to why that decision was made.
Yeah.
So I think there's a lot of things that are going on.
I don't think a reasonable person would say it was just because the president of Costco had an in with the premier or the president of Walmart. Yeah, they have a large amount of influence. There's no question about it because of the size of their companies. But you're not going to, a company like that's not going to get a government to make a decision that's going to be ridiculous. The decision's got to be founded in some sort of articulate way that makes some good public policy sense. I would probably expect. In fact, one of them I heard was, well, if you closed Walmart and Timmins, nobody could get anything because all of the small businesses were shut and only doing curbside, and the Walmart was the one source that could provide the supplies that people needed. So that and then what do you say? Only Walmart and Timmins can open, or Walmarts everywhere can open? So I think you're probably right, but I think more importantly, your whole discussion really talks to the aspect that and nobody wants to hear this, but governments have to make decisions and have to accept that there's an element of sacrifice to every single decision that they make. So, unless they went to zero, right? Unless they said, like, if you went to Dr. Tam and said, okay, how do we stop COVID from spreading? Dr. Tam would say, from a scientific and medical perspective, lock every single human being in their own private room for 28 days. When you open the doors, some of them will be dead because they got COVID and died, but the virus will be gone. But we can't do that. We just simply cannot do that. So some balance between that and, freewheeling it and just saying, you don't need to wear masks and don't worry about this. Some people are going to get sick, some people aren't. You got to find that balance. And I don't think that balance sits with everybody. We always say, oh no, you went too far this way or you went too far that way. And so it's almost impossible for any government to make a decision that's going to be largely acceptable in a circumstance like this.
I like throwing scenarios together and walking through them, right? So let's walk through a scenario where last summer, August, last summer, our COVID infection rates, I think, were in the low hundreds per day, province wide,
Yeah.
right? And we were on the verge of eliminating COVID. And certainly the COVID zero people would have said, we shouldn't have opened golf courses, and there are certain types of businesses that they would put up as standard bearers of things that you shouldn't have opened in time. But think about that. Okay, so you're a small business, you're prohibited from opening. There's basically no fear of infection, and the government is telling you, you know what? If we stay closed for one more month, we're going to get rid of COVID, and you're going to be fine. No one would have waited. I mean, people were. You own a cottage, Greg. I mean, I'm sure you would have seen the activity in August that was far different than in June and July.
Yep.
People were like, "Look, this is done. Freedom." I'm a minor soccer coach. I got my team from the previous year together to kick the ball around. I don't know if I was breaking rules or not, but yeah, I figured it's better to have kids running around having fun than playing video games, in their parents' basement. People were making these kinds of calculations all the time, and like I said, I mean, there was a demographic, 20-year-old individuals who, I don't know if you remember yourself, Greg, when you were in your 20s, but you were probably a pretty social being. You probably wanted to go out and meet your friends or go on dates. I don't know your history, but I probably guess what that was like, given the fact that I probably was doing much the same thing.
Mhm.
Right. And now you're saying that, oh, my region of Waterloo had 6 cases today, that I'm going to be staying inside, that I'm going to go outside with a mask. Like, people are obviously taking the information that's available for them and making their own risk assessments. And I think one of the failures that we as a society, and as people who advise government and as people who are in government, haven't really realized is the human behavior element to the decisions and the information that's being received. People left following public health advice last summer because they thought they were going to get sick. And when lockdowns happened again in the fall, they weren't listening.
Mhm.
And you tell me a scenario where that actually isn't true, especially for those 20 to 30-year, that in that age category.
Yep.
We kept on getting infection rates in the mid hundreds, to 1,000 cases a day. That's the demographic that keeps feeling COVID infections,
Mhm.
as they're social beings.
Yeah, I've often said from the beginning, I can remember last March when the first lockdown happened, and I've told the story many times, but I come into work very early in the morning because I'm an early riser, and driving up Heffler Road at 6:30 in the morning last March was like you thought that everybody left town.
Yeah.
There was hardly a car on the road, and for blocks ahead, you'd see absolutely no cars moving. We had our lockdown on December and stay-at-home order on December 26th. The volume of traffic on Hespler Road didn't change one iota. It was just as heavy as it had been when, last summer when things started to open up again. So I think you're exactly right. Largely people just said, well, you know what? I've been lucky this far, and there, even though, yeah, we've recorded 106 cases in the region of Waterloo, there's 650,000 people. What are the chances I'm going to come in contact with anybody? And I think people started to weigh that out and apply it to their own lifestyle and say, I haven't even, I haven't had I don't even know anybody that's had COVID, or anybody who knows somebody that's got COVID. So, what are my chances? And I think you're right. Society let their guard down as well, which didn't help in governments making their decisions.
Well, you're right. I think all of that's right. I remember going out on getting takeout on that first Saturday of lockdown or Sunday of lockdown, and thinking, like, where are all these people going? Like, there's no restaurants to go, the stores are closed. Like, where are they all going? And probably a lot of them were doing takeout, but probably some of them were shuttling kids to see their grandparents for Christmas, or doing some garage thing or whatever, or in the house. Like, I mean, how many people on this call know of families that got together for the holidays? right? Like maybe some of us, the majority of our friends or people that we associate with don't or didn't, but just based on infection rates that people did, right?
Mm,
Like and that's the reality. So people are just assessing the risk and they're saying, look, I got to live my life, there are grandparents out there. I mean, my parents would say this, although they wouldn't want to risk getting infected, but they're saying, look, I've lasted 18 months without seeing my grandkids,
mm,
without having dinner with my grandkids,
mm.
uh, which is the reality. It's true that's the honest thing that we've been pretty consistent with that. And that takes a toll on people too, which is the other element of this, which is not just COVID that we're dealing with, but everyone's mental health,
Mm.
circumstances. Opioid use province-wide seems to be on the rise. People who are experiencing mental health circumstances that are arising and illness that are arising is on the rise. There's varying data on suicide rates and suicidal ideation that are of concern as well. And these are all things that governments have to think about. It's not just COVID zero. It's we've got other public health. I mean, the surgery backlogs now in cardiac and cancer surgeries are crisis levels as well.
Mm.
So we have a lot of things that are going on that, and it's hard for us to reconcile all of that when we can say, well, my colleagues in New York State, where I teach, have been indoors in restaurants since the beginning of January. It's completely foreign to us. But they've been inside restaurants, having dinner inside with maybe 4 people since the middle of January. And I'm seeing this as like, hey, we're so far behind. But then again, I probably know more Americans that got COVID than Canadians. So they might be smiling now, but obviously a year ago, they were in the midst of massive infection and death.
Well,
So it's like
especially in New
waiting
York
to.
State, they were in a real problem in New York State. Rob, if Doug Ford phoned you up and said, Rob, I'd like to pick your brain for a couple of hours, would maybe some of the advice you might give him would be you need to really step up your communication. People really need to understand the rationale for decisions, and it's got to be communicated effectively. I know that's really hard for a politician because you got the media who picks the little sound bites, and they're looking for those little sound bites that they know are going to get the best rise out of their audience. But would communication be one of the problems that that government has had through all of this?
So yes, communication is a problem, but I think the bigger problem is that expectations are high that we need to get out of this. So so people don't respond well to bad or negative. They respond better to positive, right? Like, so if he were to call me today, I'd say, look, you wet the bed for the last 12 months. You did great for the first 4. You wet the bed for the last 12 months. Forget about that part and focus on what you need to focus on right now, which is getting people's hopes up, getting their optimism up. Making sure that you've listened and you've understood A, the concern that we don't want to get sick, but B, that we want life to return to normal or as normal as possible in fairly short order. So if I were to talk to him about what he should do this summer, it'd be get out of Toronto, go and talk to people, that are trying to reopen their business, talk to people who are in the midst of pandemic, have come up with very novel ideas on new ideas for products that they're developing, new ways of doing public service delivery, new technologies that can help us post-pandemic, deal with, life and economics and social issues. Like, talk about what this pandemic has taught us on a positive note and start getting this, getting our enthusiasm turning up again. I don't think it benefits anyone to hear, oh, we're going to lock down for 2 more weeks. I think that people need optimism. It's summer. They want to get out, and I think that there are safe ways to do that. I think government should be directing us on what those safe ways are, and have a plan to say, look, here, we're opening more things up. Good job, Ontario. Keep keep this at bay. We're going to, so I think the framework that they established last week was positive in that direction. I still think it's slow, but trying to get people's minds shifted away from the year and a half of misery to the next year and a half, which hopefully will be positive, where an economy rebounds. I mean, Bank of Canada projections are now projecting 6% growth in the economy, which is higher than projected a couple months ago. The rebounds, I just was reading the Buffalo News this morning. Unemployment rates in the United States have seen a stiff decline as the pandemic has worn off and people are rejoining the workforce. We need to fix some of the lagging problems. Labor force participation amongst women, for example, have been a huge concern. So thinking about ways in which we can get the people who were involved in the economy before, who want to be involved in the economy again, back to work should be obviously something that the government should think about. So I would say, look, you're not going to fix your past mistakes. What you have to do now is try and get people's optimism up. And if he were to call me, that's what I would tell him.
Do you think that this last, the last announcement, putting out the framework for getting back to relative normal or a seemingly relative normal life, it seems like a long time. I think you're right. We both agree. It seemed too slow, but do you think that in actual fact, what the government is doing is giving themselves a little bit of line where, 21 days in between stages seems like a lot, but giving them the ability to maybe roll the dice a little and say, you know what, we're going to give ourselves 21 days, but if things change, we can shorten that cycle a little bit rather than have to go back to the well and lengthen the cycle. Do you think that's what the motive was behind the long drawn out opening?
Yeah, I think that managing people's expectations and trying to get ahead of that rather than behind it, I think is same with the 4 months with vaccines, right? The likelihood is that there's probably going to be enough vaccines to make that 4 months, 3 months, or maybe even 10 weeks rather than 16 weeks, right? So imagine when I get a call, my second dose appointment's the end of July. If I get a call that's going to be end of June, I'm going to be like over the moon, excited about that, yeah. Right? So, which is kind of like, well, they're playing mind games with us. But on the other hand, it's better than the opposite, which is you tell me on July 20th or 21st that, hey, we're going to have to delay your vaccine for another couple of weeks. I'm going to be really upset, if that eventuality happens. So I think that managing expectations has been, and we talked about communications, that's part of the problem, right? We've not managed people's expectations very well. We haven't coalesced around what our objectives are. It's the sort of information environment is so fragmented. It's not like we have 3 major newspapers that are disseminating information anymore. It's everyone that wants to pose themselves as an expert, going on social media, filming a video and spreading the word of which is amazing, right? Because this is a problem for public administration as well, which is, I might be a member of the science. I'm not a member of the science table, but if I am a member of the science table, but I'm also a professor at a university, I can speak out and say, well, the science table was wrong because I have academic freedom at the university, And if I'm a consumer of information and I like what the renegade says, I'm going to follow the renegade, So there are lots of different things that are moving here that I think have to be understood, that aren't properly understood. And so governments need to think about it. So I think managing expectations of 21 days, going back to the framework and having that 3-week leg provides that window of, here's a little bit glimmer of hope. There's a light at the end of the tunnel and it's 3 weeks away. Mm-hmm. If it ends up being 10 days instead of, or 14 days rather than 21 days, people are going to be pretty excited about that.
Yeah. I actually was on Brian Burke's show yesterday afternoon, and he asked me about, do I think things are going to change? And then what date will we hear? So my expectation is that the framework is going to change a little bit, and we'll actually be opening things up that were supposed to remain closed. I think we'll hear about that, and reopening of some things will happen on June 5th, as opposed to waiting well into June, that is proposed now. Because I think there's a lot of things, a lot of variables happening. The vaccines do seem to be the silver bullet. You look at societies around the world who are starting to open up. The level of spread is much less. People, hospitalizations are down, ICUs are down. It doesn't mean that you can't still get it, but generally speaking, you won't be hospitalized, or you won't get into ICU. And I think there's a level of acceptance about that, and that's why you see things going back to normal. So, there's no question about it. As vaccines roll out, that is going to be the silver bullet, and the silver lining for everyone. But until that takes hold, I think we are going to see some restrictions hanging on. And I am as big an armchair coach as anybody else. I sit there when Doug Ford comes out with his comments, and I go, "Oh my God! Like, why didn't he do this? Why didn't he do that?" But you know, I guess what your article kind of brought to my attention was, man, oh man, that's a really easy job to sit there in my comfortable chair, and after he makes an announcement and say, "Nah, you're crazy. I would have done this, or you should have done this, or you should have done that." But what you're really saying is, man, oh man, it's just not that easy. Like, the volume of information that he's got to deal with, the volume of advice that he's got to deal with, almost makes it an impossible task to make not right decisions, because every decision has a positive to it, but to make decisions that are going to be widely acceptable. It's just an impossible task.
I created this, how Newton's third law, every action has an equal and opposite reaction. It's Leone's third law of politics, which is every policy decision during COVID has an equal and visceral opposite reaction, and negative reaction. So I think that plays out, because the other thing that I think, if there's one thing that you should come away with this discussion, it's not that Doug Ford or the government or Justin Trudeau and his government have not listened to the information, right? They've got way more information at their fingertips than we do. And we don't have the totality of it. So if I'm an expert in government decision making and I'm weighing in, should you do this or should you do that? I have like a very small speck of information that I'm guided by, right? And based upon that small speck of information, I'm going to make some assumptions about whether I like the decision or not. Well, governments have had to weigh in oodles and oodles and oodles of information. Sometimes people say, well, you've decided on Monday that you're not going to do something until Thursday, which annoys the heck out of me, because again, we are in Insta news. We're not in, let's think about this stuff in the public framework. Like, this is like where we've moved past, let's talk to cabinet about this and and let's not leak anything out. Like, we're past that, So it annoys me when we have this, like, well, we're contemplating a decision on Monday, gets leaked out or dragged out, and people in their answers to questions aren't sticking to script and letting some information out. Like, apparently some schools are going back on May 31st, which makes the parent in me cheer and celebrate, by the way. But, so I think we've got to handle that, that understanding that there's way more that meets the eye that had to have been weighed when they make a decision. It's painstaking. They're working around the clock through the weekends. And I know this because I'm getting calls on Friday night. He's like, we're at a cabinet meeting, Rob. I wanted to bounce this off of you, kind of conversations. So I think things are they're trying to make the best of a messy situation. And the role of information and what weighs and what doesn't weigh is important. There's a concept in social sciences called bounded rationality. And bounded rationality assumes that we do not have the totality of information available to us to make a decision, right? And I liken it to, you go to a doctor Every one of us may have visited their family doctor in the last little bit. Their family doctor, maybe not family. Let's talk about going to the dentist. You go to the dentist, they brush, they polish your teeth, and 9 times out of 10 they say, Leone, you need to floss a little bit more. And does Leone go back and start flossing every day? No, I won't floss until 7 days before the next appointment. That my dentist doesn't tell me that I have to floss, right? People take those bits of information, internalize it, and do whatever they want. And it's expert advice telling us we should act, which we will summarily accept or reject based on our human behavior, right? So I think we've got to understand the role that we only have a small speck of information. We don't know the totality of the information that leads to decision, which is magnified by 1,000 with COVID.
Yeah. Very interesting. Great discussion, Rob. I think, I thoroughly enjoyed your article. And folks, if you all you need to do is go to the hub.ca and you can search in there for Rob Leone, and his article will come up. It will change your mind on how governments have reacted through the pandemic, because it certainly changed my mind. And while, I'll still say certain things were wrong, I am understanding now where the difficulty lies in government getting it right. In fact, government will never get it right for me, for you, for anybody else, because we all have different opinions and different information coming, and we'll all tend to lean towards our side. So, Rob, thank you for bringing that forward. I think every politician would certainly want to, there's a beauty. I'm an expert, listen to me. There's no question about that. But, I think every single politician should understand that, it's about making a good decision as the best you can with the information that you have. And it's not that you're not going to get a lot of information, because you're going to get a lot of information. So we'll still complain about it till we're out of this. That's for sure. Because we're humans, and that's our human nature to complain about it. But Rob, thanks a million for taking time out of your day to come and share with us. This is going to be recorded, so we'll get lots of traction, I'm sure, on YouTube as well. Thanks very much, Rob.
Thank you.
Have a great day, folks. It's Wednesday. Get out there and make some money. It's the end of the week yet. Yeah, you can golf. Well, Wednesdays are good golf days.
Nice seeing y'all.